I will discuss the communicable diseases found in children. One of that is hepatitis. The hepatitis means inflammation of the liver. The liver is a vital organ that processes nutrients, filters the blood, and fights infections. When the liver is inflamed or damaged, its function can be affected. Heavy alcohol use, toxins, some medication, and certain medical conditions can cause hepatitis. However, hepatitis is often caused by a virus. The most common types of viral hepatitis are hepatitis A, B, and C. So, let's talk about hepatitis A. It is common in many countries, especially those without modern sanitation. Hepatitis A can last from a few weeks to several months.
You can catch hepatitis A if you eat or drink food or water contaminated by feces containing the virus. Fruits, vegetables, shellfish, ice, and water are common culprits. You can also catch the disease if you come into contact with the blood or stool of a person who has hepatitis A. When a person who has the disease and doesn't wash their hands after going to the bathroom touches other objects or food, or if you have sex that involves oral to anal contact.
Although it's very rare, but death can occur. And now, let's talk about hepatitis B. Hepatitis B is a leading cause of liver cancer. It can range from a mild illness lasting a few weeks to a serious lifelong condition. It is primarily spread when blood, semen, or certain other body fluids, even in microscopic amounts, from a person infected with the hepatitis B virus enters the body of someone who is not infected. It can be transmitted from birth, sex, sharing of contaminated equipment, sharing personal items, and poor infection control. 15% to 25% of chronically infected people develop chronic liver disease, including cirrhosis, liver failure, or liver cancer. So, finally, let's talk about hepatitis C. About 50% of people who are infected didn't know that they are. Hepatitis C is leading cause of liver transplant and liver cancer. It can range from a mild illness lasting a few weeks to a serious lifelong infection, just like hepatitis B. It spreads when blood from a person infected with a hepatitis C. It can be transmitted from sharing equipment that has been contaminated, receiving a blood transfusion, pure infection control, and through birth. Usually, the symptoms of hepatitis, they can appear anytime from 2 weeks to 6 months after exposure. Symptoms of chronic viral hepatitis can take decades to develop. Fever, fatigue, loss of appetite, vomiting, abdominal pain, dark urine, light-colored stools, joint pain, and jaundice. Now, let's talk about conjunctivitis, or the pink eye. It is an inflammation or infection of the transparent membrane, the conjunctiva, that lines your eyelid and covers the white part of your eyeball. When small blood vessels in the conjunctiva become inflamed, it becomes more visible. This is what causes the white of your eyes to appear reddish or pink. Pink eye is common caused by a bacterial or viral infection, an allergic reaction, or an incompletely open tear ducts. True pink eye can be irritating. It really affects your vision. Treatments can help ease the discomfort of pink eye. Pink eye can be contagious early diagnosis, and treatment can help limit its spread. The symptoms of conjunctivitis is reddish in one or both eyes, itchiness in one or both eyes, a gritty feeling in one or both eyes, a discharge in one or both eyes that forms a crust during the night that may prevent your eye or eyes from opening in the morning. Last is theory.
The communicable diseases that a child can have is influenza. The flu gets its name from the virus that caused it, the influenza virus. It's spread when people cough or sneeze out droplets that are infected with the virus and other people breathe them in. Yes, the flu is contagious. It spread from person to person. For every person infected, they spread the flu to 1 to 2 more people. The influenza virus causes flu. Influenza A, B, and C are the most common types that infect people. Influenza A and B are seasonal. Most people get them in the winter and have some more severe symptoms. And influenza Z doesn't cause severe symptoms and is not seasonal. Fever and other flu symptoms often go away after a week or so. But some people may still have a cough or feel weak for longer than that. Ways to reduce your risk of getting the flu includes: wash your hands often with soap and water. Cover your nose and mouth when you sneeze or cough into your elbow or a tissue rather than your bare hand. Avoid being around other people when they are sick with the flu or other infectious diseases. Consider wearing a mask if you're sick and can't avoid being around others. The communicable diseases that the child can have is common cold. The common cold is an infection of your nose and throat. It's easily passed to others, especially within homes, classrooms, and workplaces. Why do children get more colds? Because young children haven't been exposed to virus before. They get more colds than adults. Their immune system have to learn how to recognize and deal with these new germs. Children are also in close contact with other children. Kids typically don't cover their coughs and sneeze or wash their hands before touching their faces. The causes of common cold is rhinoviruses cause up to 50% of common colds. There are more than 100 different rhinoviruses. You'll get symptoms like sneezing, runny nose, cough, sore throat, headache, nasal congestion, fever, most common in the children. Cold symptoms usually begin 2 or 3 days after exposure to a source of infection. Most cold clear up within 1 week, but some last a bit longer. There are several steps you can take to prevent a cold, including wash your hands, especially before eating or preparing foods. You also want to wash your hands after using the bathroom, wiping your nose, or coming in contact with someone who has a cold. Use hand sanitizers when you can't wash your hands with soap and water. Stay home while sick to make sure you don't spread the cold to others.
Hand, foot, and mouth disease is a contagious disease that can affect a child. Hand, foot, and mouth disease is common in infants and children younger than 5 years old. Most children have mild symptoms for 7 to 10 days. Hand, foot, and mouth disease is vital illness that typically affects children, although it can occur in adults as well. It is an illness that is usually not serious, but it is very contagious. Hand, foot, and mouth disease spread easily.
Symptoms.
It is caused by a group of viruses called enteroviruses, which can cause a range of symptoms including fever, sore throat, and a rash on the hands, feet, and inside the mouth, and fatigue. Always remember that it is important to remember that hand, mouth, and foot disease is a vital illness and cannot be treated with antibiotics. Most cases of hand, mouth, and foot disease resolve on their own within 7 to 10 days. In the meantime, it is important to practice good hygiene, such as washing hands frequently and avoiding close contact with others to prevent the spread of the virus. One of the various common diseases that a child can have is pertussis. Pertussis, also known as whooping cough, is a highly contagious respiratory disease caused by the bacterium Bordetella pertussis. Pertussis derived from the word per, meaning very or severe, and tussis, meaning cough. This disease is notorious violent, uncontrollable coughing fits that often make it hard to breathe. In fact, Whooping cough gets its name from the gasping breath you might take after an intense coughing fits, which make a whooping sound. It is most commonly seen in children under the age of 5, but can also affect older children and adults.
Symptoms.
Symptoms of pertussis typically begin with a mild cold and cough, which gradually becomes more severe over a period of several weeks. Other symptoms may include a runny nose, nasal congestion, red watery eyes, and fever. Pertussis can be severe and even life-threatening, particularly in infants. It is important to seek medical attention if you suspect that your child may have pertussis. The treatment for pertussis typically involves antibiotics to help clear the infection and prevent further spread of the disease. In severe cases, hospitalization may be necessary to provide supportive care such as oxygen therapy and fluids. Prevention of pertussis is possible through vaccination. The pertussis vaccine is typically given as part of the combination diphtheria, tetanus, and pertussis DTaP vaccine, which is recommended for children at age 2, 4, and 6 and between 15 and 18 months, and again between ages 4 and 6 years. A booster vaccine called DTaP is recommended for adolescents and adults to maintain immunity against pertussis. Take note that it is important to follow the recommended vaccination schedule to help protect against pertussis and other vaccine-preventable disease. If you have any questions or concerns about pertussis or the pertussis vaccine, it is important to speak with a healthcare provider.
Little insects known as head lice feed in the blood of human scalps. The most common head lice cases are kids. The majority of the time, the insect transfers directly from one person's hair to another's hair. Common signs and symptoms of head lice may include the itching of the scalp, neck, and ears is the most typical signs of head lice. An allergic reaction to a louse bite causes this. Lice on a scalp. You may able to see the lice, but they are often hard to spot because they are small. Avoid light and move quickly. Lice eggs on her sharps. Scars on the scalp, neck, and shoulders. Scratching can lead to small red bumps that may something affected with bacteria. Head lice treatment. Head lice can cure an ordinary shampoo, but there's several common home products that may kill head lice. These products include petroleum jelly, olive oil, butter, or mayonnaise. Any of these products may be applied to the scalp and hair and covered with shower cap and leave on overnight. And there is a product my mom used to me when I was a child. This product called Lice Alice, it's like a shampoo. I applied it on my hair and leave it for 5 to 10 minutes. Then after I wash my hair, there is some of lice are dead. Tuberculosis is an infectious disease that can cause infection in your lungs and other tissues. It commonly affects your lungs, but it can also affect the other organs like your spine, brain, or kidneys. The word tuberculosis comes from the Latin word nodule, or something that stick out. If you're infected with the bacterium but don't have symptoms, you have an active tuberculosis or latent tuberculosis infection. It may seem like has gone away, but it's dormant inside your body. If you're infected, develop symptoms, and are contagious, you have an active tuberculosis or tuberculosis disease.
TB is caused by Mycobacterium tuberculosis. The germs are spread through the air and usually affect the lungs but can also affect other parts of the body. Although TB is infectious, it doesn't spread easily. You usually have to spend a lot of time in contact with someone who is contagious in order to catch it. TB can spread when a person with active TB diseases releases germs into the air through coughing, sneezing, talking, singing, or even laughing. TB infection and disease is treated with these drugs. You must take all of the medication your provider prescribes. You will have to take this medication for as long as you're told, sometimes up to 9 months.